Hello once again. This is Kukuletu Manana of the Arts and Culture of Wellness channel at Art Therapy. I cover art therapy in various uses and how it heals, and how we use art for expression. So today's topic, I'm going to be speaking about death, in the form of when people die through substance abuse or misuse. So it could be in the grief that comes with it. It can be while people are watching the person slowly die, or it could be just a sudden overdose. So how do you brush away the pain of it? So I've been covering 22 types of deaths in this series. And so what I have for you today is the benefits of art therapy for substance abuse and the grief of it, how to cover self-expression, and the challenges and limitation of art therapy for substance abuse, and my concluding thoughts on it. So for those who do not know what art therapy is, or are new to the channel or new to this type of modality, it is a form of psychotherapy that uses art, materials, and creative processes to explore emotions, reduce anxiety, and promotes self-awareness. This is done in a safe environment, so it can either be individual therapy space, like in talk therapy, how you go to a therapist talk therapy, or you can do with the groups. So substance abuse is a serious matter and a problem that leads to addiction, health problem, and even death. So obviously, I'm here doing about that, talking about that. It has moved from addiction to health problems, and now it's just being come to a point of somebody dying or family members losing somebody through substance abuse. So in this presentation, we're exploring how art therapy can be used as a tool to help individuals who are struggling with substance abuse, particularly those who are facing the end of their life. So this will also be helpful for all the family members that are watching all of this unfold. So the benefits of art therapy for substance abuse. First of all, we want to set a safe and supportive and non-judgmental space for individuals who may express their feelings and emotion, which may be difficult to do through words alone. Obviously, people get into substance abuse. It was just experimentation at a younger age, or it was through dire circumstances that gradually, escalated. So through the use of art material and creative process, individual can gain insight into their behavior patterns and substance of abuse, as well develop coping skills and strategies for managing cravings and triggers. Obviously, if people are triggered by things that happen in childhood, or they grew up in homes that substance abuse was rife, or it didn't model the environment also where they grew up in itself, the communities they grew up model maybe negative behaviors around substance abuse. So and substances and drugs were easily available, so we help individuals with that. So how people grieve and how a therapy is beneficial is, grief is a common experience for individuals struggling with substance, and particularly those who are ending. When people know what I am about to die, I know why I'm dying. Had I, should I shouldn't have. So art therapy can be a helpful tool for processing grief and loss, as it allows the individual to access and express those complex emotions in a tangible way, and those individuals can create a visual representation of their experiences and feeling, which help them to make sense of their thoughts and emotion. And it's particularly important for individuals who struggle to express themselves verbally. In terms of self-expression, so substance abuse can be important part, struggling for individuals who are struggling with substance abuse, self-expression is particularly important. an important part of the recovery process. So when we create an art therapy safe and supportive environment for exploration, safe exploration, the use of the art, through the use of art material and the creative processes, those individuals can tap into their inner resources and strength, which can help them build self-esteem and confidence, because people abuse, they feel discarded, rejected, and good for nothings, I suppose, because they feel like family members have given up on them. At times, people have given up on themselves. They've been in rehab a couple of times, or they feel like this is not working. They have no power and lose confidence. They lose a lot of things around them. So this can be particularly important for individuals who have lost a sense of purpose and direction due to their substance abuse. People can give up promising careers, promising relationships, give up on family because of addiction, and lose their sense of direction, sense of destiny, and who they are, basically, because they're so dependent. And there are some challenges and limitations of art therapy for substance abuse, even though as much as it is a powerful tool, one of the powerful individuals. One of them is that individuals may feel intimidation or uncomfortable with the idea of creating art. So in this instance, we're not creating art for beauty. We're creating art as an expression. So somebody can be an adult but operate at a level of a 2-year-old. It's not this. It's not an art skill class, but it's for creativity, for exploration of a feeling. So whatever comes, you paint. Whatever comes, you draw. Whatever comes, you sculpt. Whatever comes, you that will authentically represent how you are feeling. And another limitation is that art therapy is not a substitute for traditional forms of addiction treatment, such as medication assisted therapy or cognitive behavioral therapy, because we are helping. It's another form to add into your tool that reaches and bridges the gap that verbal therapy cannot reach. However, in spite of all this, when used in conjunction with this treatment, art therapy can be a very valuable addition to a comprehensive treatment plan. We look for holistic and when treating our patients. So, as I just to reiterate in closing statements, it is particularly important and a valuable tool to gaining insight and behaviors and developing skills and strategies into the substance abuse and what behavior, what sparked the triggers, and how the person will go on now. So it is not a substitute for traditional forms of addiction treatment. So if people still need to go to AA meetings or whatever meetings, or see their psychiatrist or so whatever help that they need, it can be a valuable addition to a comprehensive treatment plan. I need to stress that. We provide, in art therapy, we provide a safe and supportive environment for self-expression and exploration, and provide healing. Obviously, that the medication cannot heal your emotions. The medication cannot heal the brokenness that you feel. It can help you cope in, somatically and in your body, physically and stuff. Art therapy can help individuals heal and move forward in their recovery journey. So that's what I wanted to share for today. I hope you join me and have a listen into more of these topics that as I present to you. So I'm covering for this time death and the 22 types of death that people experience, and I advocate for mental wellness and social cohesion in mental wellness, and people taking care of themselves mentally as much as they would take care of themselves physically, as much as they take good care of their finances. Our mental health is important, because once that gets affected, a lot of other areas are touched and can deteriorate. Thank you so much for joining me. That's it that I have for you today. This is Guguletu Manan of the Art and Culture of Wellness. Bye.